Hi, I'm Dr. Christopher Mullane, and today I'd like to share with you the most common causes or reasons that headaches occur and the most effective treatments to alleviate them. Now, headaches occur primarily due to two reasons: major trauma and minor trauma. Major trauma would be something along the lines of a car accident or a fall, whereas minor trauma would be something more along the repetitive lines of poor posture for a long period of time, sitting for extended time periods, and even repetitive motions like turning, bending, and twisting. Now, these are all going to be considered minor trauma. Now, when headaches occur, they primarily are due to three areas that get injured: the joints, the discs, and the nerves. First, let's talk about the joints. Now, this is typically going to be in the head and the neck region where two bones come together and form that joint. Now, when the joints are functioning properly, they're going to move a little bit easier and not cause so much pressure and tension. But when they get injured, they become restricted, pressure accumulates, and can lead to headaches as that pain kind of travels down up the back of the neck and into the head. Now, also the nerves can get irritated. The nerves in the neck actually travel a couple different ways. They can travel down the shoulders to the arms, but they also travel up to the head and wrap around the sides of the head as well. So when we get pressure on the nerve or a pinched nerve, that pain can travel that length and lead to those pounding headaches and those tension headaches that can occur. And then finally, the disc material. Now, the disc lies in between two bones in the neck and essentially can put pressure in the form of something like a disc bulge or disc herniation, which again can refer that pain up into the head and cause those headaches. It also is going to have an associated muscle tension, muscle spasms that can occur, and then finally you're not going to be able to move as freely. So, kind of in summary, when those three injuries can occur, you're going to get pain, you're going to get the headaches that occur, pounding, tension, pressure headaches, those type of things. But you're also not going to be able to move your neck as freely. When you turn your neck, it may cause that sharp pain, and it's just going to cause that headache. And also those muscle spasms and muscle tightness are just going to restrict a lot of motion, and pressure will build up and essentially just cause all sorts of discomfort. So those are the most common symptoms: pain, muscle spasms, and restricted motion. Now, the three most common therapies or treatments to alleviate the headaches are going to be first, chiropractic spinal manipulation; second, electrical muscle stimulation; and the third being intersegmental traction therapy. Now, the first, chiropractic spinal manipulation, now this is applied specifically for headaches into the upper neck region. It's going to help alleviate any pressure that's being placed on either the joints, the nerves, or the disc, and allow you to move a little bit easier. You're going to be able to turn your head. You're not going to have those pounding headaches restricting you from moving, and just be able to function properly and through those different areas and segments into the upper neck and head. The next therapy that we like to use is called electrical muscle stimulation. Now, what this is going to do is going to apply a gentle electrical current to the muscles and the areas into the neck, alleviating any spasms or tension. It's going to alleviate any swelling or inflammation that can occur as well. And now you're going to be able to have a reduction in pain, and you're going to be able to move a little bit better and turn and look over your shoulder, and not having those pounding headaches as frequently. And then finally, the intersegmental traction therapy. Now, what this is going to do, it's going to traction the joints away from one another, allowing for more space and to alleviate any pressure. That pressure can always lead to those tension headaches that occur. You can get band-like headaches across the forehead. You can get side headaches on the side of your head, or even where they kind of wrap from the back of your neck and up and around to the front. So there's a lot of different pain patterns that can occur. And when these three therapies are used together, the manipulation, the electrical muscle stimulation, and the intersegmental traction therapy, they can drastically reduce or stop those headaches immediately. They can also allow for better range of motion. You can turn and bend and twist and not have those headaches just kind of stop you in your tracks. And then finally, you're going to be able to reduce the muscle spasms and muscle tensions that can cause so much pressure and tightness as well. So what does this mean to you? It means a few things. It means you're going to be able to go to work now and not have to worry about these headaches occurring. You're going to be able to do your job activities a little bit more effectively, whether it be just turning or moving your neck, or just not having that constant headache that's pounding throughout the day. You're also going to be able to sleep better throughout the night. You're going to be able to fall asleep a little bit easier because you're not going to have that headache giving you as much trouble. You're going to be able to stay asleep through the night. You're not going to wake up as frequently, and just overall get a better night's rest. And then finally, you're going to be able to do your daily activities, whether it's getting up in the morning, getting dressed, brushing your teeth, brushing your hair, putting your clothes on, whatever it may be. it's just going to be a lot easier to do when you're not having that constant pain and restricted motion due to the headaches that occur. So if you're experiencing headaches, whether it's pounding, whether it's achy or sore, whatever it may be that's into the head, please give us a call so we can help you with your headaches. You can reach us at 803-599-5902.